So this is actually none of anybody's business. However, I thought I would share it because I think maybe if I had realized this sooner in my life, it would have helped me. So maybe this will help somebody. I don't know, in the last couple of years, I feel as though I've suddenly been getting older. I mean, I resent a lot of the changes that come with getting older, but I was doing real well. And then I didn't realize what was happening, but now that my back surgery has taken care of a lot of the problems, I see, looking back, that I had been starting to have back problems that were affecting the nerves in my kind of lower half of my body. And it caused me to become less mobile. I used to go to the gym. It caused me to have to drop my gym membership because I just, I felt like I was getting a little uncoordinated, and then I started having pain, so I couldn't do that anymore. And for example, the effect that the back problem had on me, which I didn't even realize until after the surgery now, it affected my balance. And it affected the ability for me to move my legs in a more coordinated manner. So those things were happening. And today I look back and I feel like, oh my gosh, what happened? All of a sudden I'm old, and I don't like that. When I was in the hospital recovering from the back surgery, I did not have any anxiety. Now, yes, I was on opioids, but not all the time. I found it much easier to just relax and literally take things moment by moment because I had a plan. I had a goal. I knew that, well, sometimes I just had to get through the pain or get through the rest of the night, and in the morning, whatever would happen, or get through this physical or occupational therapy. I was always definitely moving towards a goal, and I felt good. It was so nice to be free of the anxiety that I often experience. Well, now that I'm home, I have been having increasing anxiety, and I've been thinking about why. Why is that happening? And it's not just been snowballing. I would say it's been like an avalanche. And I took some medication last night because I was just kind of at my wit's end. I didn't think I'd be able to go to sleep. And anyway, that broke the cycle enough that I could wake up this morning and I feel like I have a clearer understanding of things. Also, my nerves are calmed, or my anxiety is calmed, I should say. And I see that the things that have been concerning me, most of the things anyway, and causing the anxiety, it's almost like the fear of the unknown. Yes, there are some things I have coming up, and I've been preparing for them. But then, I'm thinking, oh, but what if? That's something I didn't do in the hospital. I just worked towards the small goals at the moment. And I kind of realized that this fear of the unknown, some people, it makes them anxious. Some people depressed. Some people angry, or maybe all three of those. We all have different reactions to that sort of thing. And I thought it might help to think, okay, I'm having trouble with, anxiety, depression, anger, whatever. I don't want to do things anymore. I don't want to see my friends, whatever it is that, ways that other people might respond. Why am I feeling this way? What exactly is it that I am worried about, concerned about? Okay. If you can't think of anything specific, then maybe, I don't know, maybe can you change your focus? That's what I'm trying to do. Like, right now I'm headed to church, and I've only driven just 2 or 3 times since surgery, just in this last week. And I'm just thinking about, let's drive carefully and be careful not to twist around or anything like that in the car. Take it slow, be careful over the bumps, things like that. And let's see if I can find a parking space close to the church. So I'm just trying to think ahead the tiniest bit. Now, I know that thinking in a rational way about problems does not always help with anxiety, depression. Might help with anger, maybe. I don't know. But it can, try it, it might help. At the moment, it's helping me, all right? Now I'm going to get out of the car, and I am going to make sure to use my cane, just in the event that I become unsteady, and just try to take it step by step and not be thinking ahead. Sometimes it takes practice to discipline yourself to not think ahead. Sometimes you need to think ahead, right? But for my life right now, I just need to get through right now. Maybe this will help someone. So I just want to make something clear. I am not telling you to do any of these things or saying that this is going to fit every situation, because I recognize that each one of us is different. We have the reactions and responses to things in life because of all sorts of different reasons. I don't know what your background is, what's going on under the surface. You may be anxious for totally different kinds of reasons than I am. But I'm thinking that if I had heard somebody say the things that I have recently become aware of that I've shared with you here, if I had heard that, it might have gotten through to me and helped me. And honestly and truly, if this helps one person, even one person, to start thinking about things maybe in a different way, where you can break out of a sort of vicious circle of going round and round and never getting anywhere, it's worth it, because I know how meaningful it would have been for me to receive some kind of help. Each one of us matters. Each one of us is different. Advice has to be taken based on our individual situation. Certain advice may work for one person, not for another. So if this helps you, I'm really glad. You don't even need to tell me. I just felt like it was significant enough to share it, that it might help someone. So you may say, why is she doing this while she's driving? Shouldn't her mind be on driving? Well, I do a lot of thinking while I'm driving. So honestly, I'm just thinking out loud here and sharing my thoughts with you. There's one other thing I wanted to add to what I've been saying. I have found it's been a month since my surgery, or golly, I don't know, it was January 29th and today's March 2nd, so you can do the math. I found that I'm just a little confused sometimes. I mean, like when I'm using my computer or my phone, I'm not as quick to pick up on what it's telling me to do or how to do certain things. I just get a little confused a little bit more easily than I did before the surgery. And at first I thought, oh boy, I'm losing it here. I'm suddenly, as I shared in the beginning, I'm getting old, and it's just, coming on like somebody backed up a dump truck full of old and let it loose on me. But I thought, let me just look something up. So now sometimes Dr. Google is not a good doctor, okay? Because Dr. Google doesn't know you and has not checked you out personally. But for some things, even some medical things, Google can be helpful. So I didn't know how to word it, and I didn't know if Google would respond to a sentence that was a little complex. But I said, how long can you be fuzzy-minded after surgery? Well, the immediate response from Google was that there's a thing called, and I hope I remember these initials correctly, POCD. I think it's something like post-operative cognitive, I don't know, deficit or something like that. Anyhow, it actually used the term fuzzy-minded in the description, that you can be fuzzy-minded for a few days, a few weeks, even a few months. Oh my gosh, what I've been experiencing is not just me falling apart or something. This is a thing. And especially speaking to you people who are perhaps a little older, and you know, it's more common when you're older to need surgery on something, and sometimes it's a little bit hard to come back from surgery. You know, and you can be depressed after surgery and stuff like that. Well, oh my goodness. You know what? If you're having unusual feelings, sensations, pains, difficulties, see your doctor and find out. You know, maybe it's not just you going crazy or falling apart. It may be you experiencing some actual medical thing that in some cases either can be taken care of easily, or just the fact that you understand the cause. Like in my case, no, I don't think I'm just all of a sudden getting old and decrepit. I think that, you know, this is an after effect of the surgery for me, and it did say that this is more common in older people, to have it last longer. So, you know, don't depend on your own negative and worried thoughts about stuff. Don't depend on Dr. Google. Oh my gosh, so many things I've looked up on there. You know, I was ready to die according to Google. But go to your doctor and see what's up.